Today we're going to talk about Chapter 4, the endocrine system. This is a very small chapter and so therefore a very short lecture. You probably noticed when you were putting in your tabs in your new CPT code book that there were no tabs for the endocrine system. And all I can figure is because it is very small. So what I suggest doing is just using some of those blank ones that are with your packet of codes and writing, like this one says endocrine. And it is just after the female genital system. So I have it between the female genital system and the nervous system. Just a little code there. And it's referring to these few codes in the endocrine system. Starting here in green, it tells you it's a new body system. The red is the parts or subsections of the body within this system. And then the blue, the procedures on this part of the body within this body system. Okay? So just keep that in mind. And here are the parts of the endocrine system. I thought this was a pretty good diagram. Again, Google Images, that shows where the various glands are. And you notice that not all of these glands are included in the endocrine system. The male and female body parts, the ovary and the testicles, they are within the male and female genital system chapters. Is included. So within this chapter, we have the thyroid gland, the parathyroid, the thymus, the adrenals, the pancreas, and the carotid body. Okay. So I'm just going to go through some exercises. The first is the parathyroidectomy. And there's your index and code, pretty straightforward. A laparoscopic adrenalectomy, complete. And there's your codes. And you note, I have here that there's a misleading index entry for this example that takes you to 50545. When you go to 50545, that is a nephrectomy, removal of the kidney, where you're taking the adrenals with the kidney when you have that procedure. So this particular example is not the nephrectomy, it is just removing the adrenals. So be very careful when you're reading your code descriptions, like I've told you over and over, to be sure you're not taking more than you want to take in a given procedure. A percutaneous needle biopsy of a thyroid gland. I've included a few examples here from the clinical coding workout. This is a textbook that you can buy from AHIMA that gives you more examples of coding, both inpatient and outpatient, both ICD-10 and CPT. It's a good way of practicing if you want to pursue coding as a career. As I think I've talked about in my syllabus and possibly in some lectures, the goal of the coding classes in this program is to give you a foundation, and then you'll have to get more knowledge and or experience on your own post-graduation. There's not enough credits that are focusing on coding to get you through all of this. What I do think you get from my lectures, at least, is that I'm just giving you a foundation and teaching you how to use the code book. That's the best I can do in the time I've been given. So here's the example of this particular question in the clinical coding workout. Here's another question in the clinical coding workout and its answer. You see that you have to read the code descriptions here, and you find that 60540 is appropriate because there's no documentation of any excision of a tumor in this diagnostic statement, just the exploration and the biopsy of the adrenals. That's all I have for this short section. It will, however, be game on an exam, so don't forget about it. Post any questions you have in discussion board along with the index path you use to try and find the code, and I will address them there. Thank you very much.